Hello everybody and welcome back to another video of the FNC Concussion and Brain Recovery Summit of 2025. So my name is Dr. Alexis Romas. I am a chiropractor and today we're going to be talking about primitive reflexes in concussion recovery. So primitive reflexes are like the foundation of movement. What are they? They're automatic, hardwired movement patterns in infants that are essential for development. So the transition is, as the brain matures, these reflexes are normally integrated and suppressed by voluntary control. The problem is, after a concussion, brain injury, whiplash, this suppression can fail and the reflexes can re-emerge, interfering with that recovery. So, the neurological basis, why do they return? So first we can have loss of cortical inhibition. So the frontal lobes are responsible for top-down control and are impaired by injury. This allows your primitive brainstem reflexes to resurface. With cerebellar dysfunction, your cerebellum defines and coordinates movement, and if that's disrupted, it unmasks underlying reflex loops. With brainstem sensitization, trauma can make these primitive motor circuits overreactive or hyperexcitable. And with cervical vestibular disruption, injury to neck and inner ear alters your sensory feedback, further destabilizing this higher level control. So concussion can essentially pull the nervous system backwards into a more primitive state, relying on old software instead of optimized control, and we tend to have an escape of these primitive reflexes. By not paying attention to these reflexes, some patients can hit a plateau in typical concussion recovery due to unknowingly fighting these reflexes constantly. So, clinical signs and associated symptoms. We have a couple of examples of our reflexes that we have, and I'm going to tell you kind of what they start off with as you're a baby and then kind of how that can persist as an adult. So we're going to start off with the Moro reflex, and typically this is a baby reflex in rapid extension followed by flexion in response to something shocking like a loud sound, light, loss of head support. This is a super important reflex to have as a child to ensure that they start responding to startling stimuli. However, when you have these reflexes as an adult, it can create a lot of greater issues. It can present as an exaggerated startle over very minute things. You can have anxiety, latent sound sensitivity, and autonomic surges. With your asymmetrical tonic neck reflex, that's your ATNR, it's a primitive reflex that causes an infant to extend the arm and leg on the side they turn their head towards while bending the arm and leg on the opposite side. This typically develops in babies to help an infant develop hand-eye awareness and coordination. When this reflex still persists in an adult, it can disrupt reading, balance, throwing accuracy, or gaze stability. With your symmetrical tonic neck reflex, that's your STNR, in babies, it helps them separate their upper and lower body movements, and it's super crucial for developing crawling skills. When a baby is on their hands and knees and they lift their head, the STNR causes their arms to straighten and legs to bend, while bending the head has the reverse effect. Head movement alters your limb tone, which affects your core stability and posture. A persistent STNR impacts tasks like posture transitions and getting up from the floor. For your tonic labyrinthine reflex, or your TLR, in a baby, it's the reflex where the body curls up when the head tilts forward and straightens when the head tilts back. As an adult, head tilting causes excessive muscle tone, worsening dizziness, errors in spatial awareness, and can contribute to balance issues. With spinal galant, that is a reflex that's triggered by stimuli on the back, and the muscles on the same side tighten, twitch, or jerk towards that stimuli. It's a crucial reflex to help infants navigate through the birth canal and further helps develop balance and coordination to help prepare the body for crawling and walking. But in an adult, a continuation of this reflex can cause pelvic asymmetry or low back discomfort during walking. So sometimes if you have low back pain consistently, you're seeing your chiropractor all the time, and you're still having this pelvic asymmetry, they keep adjusting it over and over and over again, it could be because we have this spinal galant reflex that's persistent, and it's something that's not being brought attention to or treated. So, we have clinical evidence for reintegration protocols. So there was an article that was written by Ziax and Brown in 2018 that first wanted to document primitive reflex disinhibition in a concussed individual and highlighted the need for targeted reintegration. So they did a retrospective study of 82 patients with persistent concussion symptoms. Their findings were that patients who received a rehab protocol, including primitive reflex integration, vision therapy, and vestibular rehab, showed significant improvements in symptom scores, balance, and functional recovery compared to those who didn't. So primitive reflex testing and targeted reintegration are measurable, evidence-based interventions in modern concussion care. So, some comprehensive rehabilitation strategies that we tend to use here at our office at the Functional Neurology Center. So reflex suppression drills. So we can have targeted movement patterns designed to re-engage cortical control and dampen primitive reflex expression. We could also do cervical proprioceptive training. So using tools like the Neck Care 3D, laser-guided head positioning through tools like motion guidance, and chiropractic adjustments to help restore proper neck-to-brain communication. We do lots of different vestibulo-ocular rehabilitation exercises. So, for example, we do VOR adaptation, saccade training, and we do this to override this reflex-driven instability and improve gaze control. We also do different visual therapy. So, for example, we have IBAB, we do Dynavision D2, and we also have advanced neurooptometric co-management to address persistent oculomotor deficits. We also do neuromodulation. So we're utilizing technologies like Erconia low-level laser therapy and transcranial PEMF to improve cellular energy and stabilize brain communication. We can also do other dual task integration, combining movement with cognitive tasks to reinforce higher level brain networks and prevent regression. Now, we can also utilize multiple of these therapies all at the same time. So I know something that I tend to do is if I'm using the Dynavision D2, I can also activate dual tasking integration at the same time. So with Dynavision D2, you can have, okay, if a red light shows up, I'm going to hit that with my right hand. And then if a green light shows up, I'm going to have them go ahead and name an animal for me, just as an example. So it's like you have to inhibit that thought process of, okay, I'm not going to touch the green light. I'm instead going to come up with something that is in that category. So it's having that dual tasking of having those motor movements while also integrating higher thought processes. So this multimodal approach retrains the brain to work at a higher level of integration and dampen down persistent primitive reflexes. Now, beyond recovery, implications for optimal performance. So you can have subtle remnants. So even in healthy individuals, subtle remnants of primitive reflexes can interfere with athletic performance. Integrating these reflexes not only aids in recovery, but can also unlock hidden performance potential. So for a soccer player, if they have an unintegrated Moro reflex, it could cause an overreaction to visual distractions. Or if you have a baseball hitter, an unintegrated ATNR can compromise rotational stability during a swing. So realistically, if you have some of these overlying things that are there and you're just performing the best you can, it could be better if you treat some of these conditions. So, conclusion is a new roadmap for concussion care. Beyond symptoms, concussion recovery is more than just managing a checklist of symptoms. It's about restoring the brain's fundamental hierarchy. The roadmap. Evaluating primitive reflex gives clinicians a targeted roadmap to address the most foundational neurological disruptions. The goal: by integrating these reflexes, we help patients move beyond a state of neurological survival to a state of optimal performance in both daily life and sport. Here are the references for everything that we talked about during this presentation, and I want to thank you all for joining me today. I hope that you guys find the links for the other videos on this page, and I really appreciate for you all taking the time to sit with me, learn about these primitive reflexes, and just have some ideas of what to do in the future and how to move forward. Thank you all so much.